Hello, my name's Georgina Moore and I'm a speech and language therapist at the Enfield Integrated Learning Disability Service, and I'm here to talk to you about our accessible information project. So the rationale for our project, so up to 90% of adults with learning disabilities have communication needs, and we know that people with learning disabilities frequently experience massive health inequalities as a result, and they do not always feel fully involved in decisions about their health and social care. So our project aims to address this issue. So who's involved in the team? So we employ experts by experience, so that's adults with learning disabilities and autistic adults, and each have their own communication needs and their own experiences of accessing health and social care services, and they're supported by a small team of professionals. So we have the Easy Read experts who review and give feedback on Easy Read content, and we have office assistants. So we've got our Easy Read content creator and our mail shot assistants too. So the role of the accessible information team is to review, create and distribute Easy Read and accessible information. So that includes our paper and email Easy Read newsletter, Easy Read information leaflets, Easy Read appointment letters and report templates, our Enfield My Life website and the Learning Disability Partnership Board minutes. So why do we deserve to win? So Enfield is ranked the top in London for the number of people with learning disabilities in employment, and we have 7 people with lived experience working to improve communication accessibility for people in our borough and further afield. So we are facilitating co-production in line with the Care Act and ensuring we are meeting the accessible information standard, and the project is working, so we're going to discuss some of the outcomes. So we've received very positive feedback from those who use our services about the Easy Read information that they receive. For example, we've been told that our accessible letters help prepare people. They hold on to them and refer back to them, and this helps reduce anxiety. Our accessible reports can help prepare people for discharge because they can easily access information about their assessment and recommendations and how to contact us if things change. Our Learning Disability Partnership Board members look forward to receiving the minutes and other papers in Easy Read. This helps them to feel properly included and informed. Our website information is also accessed by more people than just the learning disability population, and not just in Enfield. For example, parents of adults going through transition from child to adult services have said that the Easy Read pages are much easier information to understand, particularly where English was not their first language. Our COVID page was the 3rd highest visited page during the pandemic. This Easy Read page was updated daily, and in 1 week we had 1,700 unique visitors to this site. We've also been supporting external teams who have reached out to us for support in creating Easy Read and accessible information. For example, the Easy Read experts reviewed and gave feedback on some Easy Read information about cervical screening produced by the NHS and Joe's Trust. And this was really important because we're trying to increase access to this vital health screening for people with learning disabilities nationally. 2 other boroughs and councils have been in touch asking for some Easy Read design advice after seeing our My Life website. Council members in Enfield involved in creating an Easy Read autism strategy approached us for support and training in Easy Read. We were also asked to work with the local hospital to develop their skills in creating Easy Read information for patients. The community therapies team in Enfield also approached us for training in Easy Read, so they work with people with acquired neurological conditions and degenerative neurological conditions with communication needs. So next we're just going to watch a video to hear from our experts by experience and why this project is so important to them.
Hi, my name is Harry. I work at Equals. My role is an office assistant. I basically just help around the office. Easy read, in my opinion, is important because not everyone is able to get through like a 70-page document, and it's kind of ridiculous that anyone should be able to have to get through all that. So easy read is both essential for people who can't read massive amounts of documents like myself, who just don't have the attention span or the comprehension for it. It's also good for just general use, and it gets rid of a lot of the jargon that people don't understand outside of the workplace, and it's good for when people just need a little help. And I feel like working with Easy Read, even if my job is admittedly fairly small, I'm brightening someone's day by helping them feel included in the conversation.
My name is Barry. I'm an easy read expert. I'm just one of 5 people who does this job. What I like about the job is that you get to meet different people and move around places to different places. I also like the way the group comes together. It's not like where there's one person who thinks they're the best and that we're all equal and we're all the same. Why is it's really important. Well, I just think it's important to realise that not everyone can do their job as well as they think they can. Basically, because we work out other people's problems and how to solve them.
So how do you feel when you don't get easy read information, Nick?
When I don't get easy read information, I get a little confused. Sometimes I miss out on appointments, or I get people to read the letters, and sometimes I have to ring up the hospital or the person that sent me the letters to try and understand a bit more and clarify if there's things that I've understood.
Thing is, when I do get easy read, is when I get like a letter through the post and it's got pictures next to words. I open it and I think, well, at least I can read this now, because I don't have to ask somebody, oh, what does this mean? What does that mean? And they put it into like pictures and words that I can understand. And if I get lost, I can just look at the letters. Like if I've got a hospital appointment and it's in easy read, I think, what's this about? Then I can look at the pictures, think, oh, I've got an hospital appointment on a certain day at a certain time, and I can see who I'm seeing at the hospital or the doctors, and it makes me feel like jumping for joy. And if someone says, what's this about? I said, just look at the pictures and it will explain.
Yeah.
And it makes me feel on top of the world.
That's really good. So it helps you be much more independent, doesn't it? Thank you, Naomi. Thank you.